This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHD-HD, WOGL-HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning. It's a beautiful day in the neighborhood and a beautiful day to get healthy. And that's why we're here, to do our best to help you do just that, get healthy. And that's why we call it Health Watch. Every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. As you heard the man say, Dr. Molly Fantasia is here. She is the PhD doctor and executive director and founder of Innovative Medical Associates. They are located in Marlton, New Jersey. On the show today, we'll tell you everything we can possibly fit into this hour about Innovative Medical and how they can help you improve, you and your family improve your overall quality of life. Stick around for that. If you have a question or a thought for Dr. Molly, 855-839-1210, 855-839-1210. We promise we will talk about a lot of things, a little bit of COVID-19, but a lot of other things.
You
okay?
bet, John. You bet. I'm sure all our listeners are tired of hearing about COVID-19.
Oh, brother. It's just the endless cycle of COVID-19 news.
And you know what? How is all of this churning it up every day? If people just follow good health habits, wouldn't that be okay, John?
Absolutely. And we're going to talk about that later on in the show. But I wanted to ask you, and again, the number here in the studio, 855-839-1210. If you have a question for Dr. Molly, 855-839-1210. I wanted to ask you, as far as what you do.
Sure.
And we go over this every week because invariably when we do, you do get phone calls, and people say, well, what do you do, Dr. Molly? What do you do, Dr. Molly?
Well, we are a licensed primary care facility. In other words, Innovative works out of a licensed primary care facility. So our physicians, our healthcare providers, we are like-minded in that certainly if you need a medication, we can prescribe it. Everybody, the docs there can prescribe it for you. So if you need an antibiotic, an antiviral, since that seems to be appropriate right now, we can do that. But our philosophy really is to use the least amount of pharmaceutical meds that you can do to effectuate the change that you want for the particular problem or challenge that a patient has. So that's the long and short of it.
So it's pretty much, I guess, against what we've been taught all our lives.
Sure.
Go to the doctor, get a pill.
Get out that pad.
And then whatever happens. But
Correct.
This is not what you believe in.
No. All of us, we share a common belief in that you use medication when it's appropriate, and you take a step back and see how else you can improve the quality of life for a patient in other ways with more natural substances.
Okay, we already have a call, which is good.
Great.
We always tell them call in early.
Well, I'm glad they're doing it,
That's right,
John.
yeah. Bob is in Cherry Hill. Bob, good morning. You're on
Hi,
Health
Bob.
Watch with Dr. Molly.
Good morning. I have a question. I'm scheduled to get a pacemaker in about a couple of weeks.
Okay.
I know some things about it, but I've talked to people who've had it, and I'm sure Dr. Molly has had many people with pacemakers, and
Yep.
I just like her opinions and experience that she's had with pacemakers.
Hey, Bob, help me out, though. What brought you to the cardiologist in the first place? Just give me a little history, if you don't mind.
Well, 22 years ago, I had a stress test, and the bottom part of my heart was not functioning. The little point of the heart.
Yeah, sure. One of the little, yes,
so,
go ahead.
I went in, and I got 2 stents.
Okay.
And the stents, over the years, I picked up 4 more stents. So I now have 6 stents.
Whoa.
And my aortic valve was getting closed, so I have a new aortic valve.
You did have the valve replacement. Cool. Very good. You had it.
The I think the THCR, I think they call it.
Good.
And I'm
How old are you, Bob?
I'm going to Penn. I have confidence in the doctors and all. But my ejection fraction used to be, before I had a heart attack, was about 60.
That's great. That was good.
Well, it's not now. It's like 35 now, and I feel it. I am definitely in heart failure, and
okay.
I've lost energy, and it's just.
How old are you, Bob? How old are you?
I'm 85.
Okay.
Oh, you're a kid.
Yeah. Listen. I mean, obviously, you have a bunch of cardiac issues. How come you never did any chelation? You sound like a very smart man. So you must have listened to Irv Homer for many years about chelation, right? How come you didn't do any? Go ahead. Did you read about it?
It's such a departure from. Once you are going to sort of a certain path.
Sure.
It seems to me it's a major departure, and frankly, it's a little scary to me, chelation.
Sure.
It's sort of a radical step. I don't know.
Right. I understand. I got a flavor for how you think and whatever. And so in that case, I would say run in, get this pacemaker so you feel emotionally better. And I'm sure, really, at 85, I think your pacemaker is going to give you some quality of life. I hope you would possibly think about some cardiac nutrition, though, in addition to that. By that, I mean things like D-ribose, possibly. How's your cholesterol and everything now? The rest of this, all good?
Well, I give my doctor's help because my cholesterol has never been high my whole life.
Good.
So I say, well, look, you guys have been treating me for cholesterol. And now it's inflammation more than cholesterol.
Right,
right.
Smart.
It's been a downward path. So I said, I don't know. You get discouraged. To tell you the truth.
Understand. Don't be discouraged. Listen to me.
Hang in there, Bob.
Listen, get the pacemaker, and maybe call me afterwards, and we can talk about some nutritional supplements that may aid you in this. Okay?
All right, Bob. Thanks
You're
for the call.
You're a good man. God bless you, and
for
good
the call,
luck.
Bob. Appreciate
good luck
it.
with this.
All right?
Yeah, interesting call.
Here's what I got out of this.
Yeah.
All right.
Yeah.
And again, I mean, had I never met you, I don't know that I would be in the path that I'm in.
Of course.
But it seems like the mind was closed to that.
Right. At the time, he was closed.
So I guess I was having trouble understanding what was so radical about chelation. That's
well. Let's talk about that.
Yeah.
I mean, since he brought it up, let's talk about it.
Right.
It's not so radical. It's been around since the 1950s. They were using chelation back in the day, actually, as an occupational medicine remedy for things like lead poisoning, and also using it in children, believe it or not. Actually, in children at that time, because lead paint was on the windowsills and stuff, and kids were sucking that and getting all kinds of lead poisoning problems. So chelation in and of itself has been around for quite a while. Now, there have been advances, too. I'm a very lucky woman in that I'm a member of something called the American College for Advancement of Medicine, and that is exactly as it sounds. There has been improvement in the chelation process, in particular for cardiac issues. So not only do we know that it opens up blood flow 12% head to toe, and that it continues to actually take away the stuff that clogs the arteries, but there are other things you can do during this period of time. So there are many things, and I would say using cardiac nutrition is one of them.
It reminds me of your late founding physician, Dr.
Dr. V.
And
He
he
was
always
the
used
best.
to say, it's like liquid plumber for your blood flow.
Only in our case, not only is it the liquid plumber, but then what we do is we actually help the new vessels, etc., in that we give you cardiac nutrition. Off the top of my head, I would think of things like taurine, D-ribose, just a series of things, certain B vitamins that we coenzyme Q10. So there are so many things. So when you come into our facility for chelation, first of all, we don't just jump to chelation. What we want to do is look at all of your tests, including the interesting thing he said about his echo.
Yes.
Looking at his echo and his ejection fraction. And then we might want to give him the cardiac nutrition piece, even without the EDTA. So there are many things. And again, what do I always say, John? Individualized. Our chelation is individualized as well.
Yes. And I also wanted to mention when he said it's radical. And I thought to myself,
it was radical 40 years ago, maybe,
right?
But not now.
It was radical because someone told you it was radical.
Exactly.
And that's so. This is
you know what? I think we do something called radical medicine because we get people who've suffered from traditional desperation medicine.
Right, exactly.
So, yeah, if you want to call us radical, okay. But I will tell you, we're radically safe. So that's the difference.
Yeah, okay. Coming up on our first break of the morning, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia. She is the PhD doctor and executive director and founder of Innovative Medical Associates. We kind of took a call and got off what we were starting to talk about, but we're going to get back to what they do and how they do it and why they do it and all of that. And plus your calls again, 855-839-1210, 855-839-1210. Coming back with more of today's Health Watch after these words. Back here on Health Watch, as always, operators are standing by right now at Innovative Medical Associates, and they can be reached. Simple phone call, 856-489-0505, 856-489-0505. Call, ask a question, want more information. And, of course, if you want to set up an appointment with Dr. Molly, the initial consultation is complimentary. All you have to do is call and set it up, 856-489-0505. We had a joke around Dr. Molly's office the other day that the next initial consultation that is only 15 minutes will be the first.
Yeah, it is true.
Right?
It is true. I mean, even in the phone call, you notice I had to get into it a little more.
I know it's in your nature that you can't wrap it up, and you put the timer on there, and then you ignore the timer.
You know what? Inquisitive mind. I'm sorry. Okay, I love people.
But it is kind of the joke.
Yeah, it is a big joke.
15 minutes? Oh, okay.
Yeah, okay.
Well, listen,
anyway,
but you're thorough, and that's
we
that's
try
a good
to be
thing.
as
That's
much
a
as
good
we
thing.
can.
All right, 855-839-1210 is the number. Also, I wanted to mention the website is innovativemedicalassociates.com, innovativemedicalassociates.com. And in case you did not know, our show is replayed every Sunday afternoon from 4 to 5. We call it the Health Watch Replay. So if you miss some or you miss it all, listen, maybe you go to church early so you can catch it in the afternoon 4 to 5 here on Talk Radio 1210 WPHT. Our number here in the studio, 855-839-1210. If you have a question for Dr. Molly, 855-839-1210. I have my usual, my hydration on Thursday.
Right.
And I was lucky to get a seat on Thursday. I said, what is it, standing room only? The place was busy.
Exactly.
A lot of people were there.
A lot of people have a lot of problems, John. And, part of the issue is, of course, I am really trying to follow the social distancing. And because, again, Innovative is operated out of my facility. So I really make sure that everything is done according to Hoyle in terms of infection control. And as you know, God bless my nurse, Barbara, we don't fool around with that. So that's part of the issue, too. So it's important that people adhere to their appointment times if they can. Because I want everybody to be seen, as you know.
Exactly.
And hydration is the cornerstone of what we do.
And I wanted to reinforce that because we started talking about it before we took the call. But it's hydration, and it's the specific hydration for each patient.
Correct. And again, you'll see that people may have anywhere from 1 to 3 or 4 bags. And by that, I mean smaller bags. And why do we do that? It's because I'm looking at each person's record. By the way, I generally go over everybody's protocol with my doctors at least once a week so that the changes are made and I'm able to move forward. So I meet with my physicians on an ongoing basis, even though they may not be there all the time. But, of course, our nurse is always there.
Yeah. I think we also want to mention, and I know you find this very important, and I know it's important because, listen, I'm there once a week, and I've known you for years, is that when people call you, they really get the most out of the consultation.
Absolutely,
because even that's complimentary.
Right.
But it's hard for you to answer their questions on the phone and diagnose on the phone.
Well, I don't diagnose at all.
But you can't, and they may expect that, right?
Right. I don't diagnose at all. But if they come to me, I will ask what is their condition and when did they get their diagnosis and what is it.
Right.
Sometimes it's interesting. I believe some people come to me and they're a medical mystery. They may think they have one diagnosis, but then in talking with myself, maybe Dr. Pat, Dr. Mark, you find that, we're thinking a different way entirely. So that's a whole other issue.
Yeah, but I wanted to impress upon people that the initial consultation is complimentary, and we were just joking with you about 15 minutes.
Yes,
it's a little more than that,
Of
but
course.
that's where you can get the information.
Right.
And it is really hard for you to answer a bunch. I mean, you answer every call.
I try
but
to.
It's hard for you to answer the questions over the phone if
Right.
they're not there, and then you can really get into it if they're there.
Exactly,
So
John.
that's important to set that up, that initial consultation.
It is.
And
It
there's
is.
no obligation, so that everybody knows that.
Nobody pulls you in the chair.
Right, right. So let's talk about the amount of hydration. And I know you have some people coming in 2 times a week. I'm a once a weeker, but I'm kind of on a maintenance schedule.
Right, at this point,
But,
sure.
but what is kind of, is there a norm?
There is no norm. What there is there's protocol.
Right.
And protocol depends on what the patient is coming to us with, what the patient wants to accomplish, and how long does it take to accomplish this by utilizing the constituent in the natural product that will allow us to effectuate the change. So, for example, if you have what I consider a chronic condition, you may need to be in maybe twice a week for a certain period of time. My cancer supportive people can be in anywhere from twice a week to 4 times a week, depending on where they are in their cancer journey. So a lot of this depends on the patient. Some of my autoimmune people now are down to once a month because they have completed a series of 30 treatments or 40 treatments, and they've seen the changes and the positive changes. So then they can go down to once a month or once every 3 weeks. And a lot of that, because the patient knows his body, believe me, most patients know their symptoms, they know their body. They'll make a decision at the end of a protocol how long they need to come in, what is the follow-up. And I'm all for that. I'm here to support a patient in their healing journey.
So it's kind of heavy in the beginning,
right, and
to
it
really
tapers
attack the
off.
problem,
Right.
and then you kind
taper.
of, yeah,
And
okay.
again, if you come to us with 10 things, you can't expect that I can do all that in 5 treatments. It's
Yeah.
not going to happen.
Yeah.
It's not going to happen.
What is there an average amount of treatments?
Usually it runs between 10 and 30 or 40 treatments. And again, so depends on the severity, how long you've had the condition. I tell you, the earlier you get in, the better it is, right?
Yes.
So if you find that you're having some numbness or whatever, or some problems with pain, it's good to come in before they get severe. But it's also the kind of thing that after people start, I find most people want to come back because they feel so good. They want to tune up. So,
Yeah, we mentioned earlier, we were talking about, we just touched on COVID-19.
COVID-19.
And you said to me before the show, you said, well, if people do what you do, meaning me, they have a good shot of staying healthy.
Right. I think it's so important. COVID has become such a, nemesis. We live, eat, and breathe it, right?
Mm-hmm.
Because now we're seeing numbers go up again, and like everybody is just completely in a turmoil about this. My thing is, why aren't we looking at this like every viral infection? In other words, good infection control policy should be in place. Yes, wear your mask. It's not such a big deal. Wear your mask.
Right.
Not a big deal. All right. That being said, what are the kinds of things you could do to protect yourself from COVID? Well, you could take vitamin C. You could take zinc lozenges. You could take black elderberry. You could take green tea. Now, these are the natural kinds of things, right? They're just some of them. And if you maintain a certain healthy lifestyle, you don't start eating a bunch of junk food. You're not out there losing sleep, right? And I mean losing sleep over COVID.
Right.
You got to stop all that. And you got to say, okay, you got to get enough rest. You have to regroup. You've got to be judicious. Don't go out with 500 people you don't know. I mean, those are the things we can do. And I think if we all work together in that vein, we can stop this thing in its tracks. I mean, this has been a very long and arduous process from the healthcare provider point of view.
And I wanted to mention to you, because a friend of mine has no spleen.
Oh.
And he doesn't basically go out of his house at all. Okay.
Right.
Now, he's older than me.
Sure.
And he had a heart attack recently and had prostate cancer like 20 years ago.
God.
So he's got some challenges.
Right.
And he says, I don't want to go anywhere. He says, how do you do it? And then I mentioned you, and I mentioned vitamin C. He says, you get vitamin C every week?
You do.
I said, yeah.
You do.
And I said, I don't get colds. I don't get, any of those kind of things.
And listen, with the help of God, this isn't magic. Vitamin C has an antiviral kind of component because of the high antioxidant. Again, it's the extracts that make a difference, but we won't go into that today. But I have to tell you, what we want to do is we want to maintain our health by maintaining. Listen, how about do you go to chiropractic? There are people. I believe in chiropractic. Those physicians help you stay healthy.
Yes.
So go to your chiropractor. The biggest problem I'm having right now is getting my people into their specialists. Even we are having a hard time getting face-to-face kinds of clinical evaluations. Everybody wants to do the telemedicine. And as my old good friend has said, the dermatologist, he likes to know how you can do all this telemedicine.
Yeah,
right?
I'd like to know that too.
It's like, don't you put your hands on people anymore? It's like, and then you wash them and you follow infection control.
Exactly.
But it is what it is right now. And we've got to really, we've got to adhere to this. So I want people to stay safe, but I think it's really important to tone down the anxiety related to this. Maybe take some ashwagandha.
Yeah, well, that's the other thing. By the way, I've seen ashwagandha now advertised on TV.
Of course.
Have you seen
Who
it?
was ahead of the curve? Dr. Mo.
And I saw the commercial, and I said, they must be listening to Dr.
They
Molly.
are. They are. Yeah. You want a good ashwagandha, though.
Yeah,
Okay.
and you'll tell patients. And
of course.
Your nurse Barbara will definitely tell patients.
Absolutely.
But I guess the question is, maybe the stress caused by COVID is maybe worse.
I would say so.
Than anything.
I think the stress has worn people down.
Yes.
And we all know that stress has an effect biochemically on what's going on in our bodies. So let's look at it that way.
Yeah. But would you recommend that if you really don't have any medical challenge and you want to just boost your immune system, could you come in for just a vitamin C drip?
Absolutely. And again, it would be a medical vitamin C drip.
Yes.
We would look at this as medical hydration, not as foo-foo hydration. You like that?
I like that.
Well, because I see this.
Maybe you want to patent that, okay?
Yeah. Maybe we should use it as a tagline.
Exactly. Coming up on a break here, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. It's Dr. Molly Fantasia. She is here, the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You have a question for Dr. Molly, good time to call in. We always tell you call in early, and we had an earlier caller, but we always get every week, like somebody tries to call at the very end. We don't like not being able to take your call. So you want to call now, 855-839-1210, 855-839-1210, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by during the program, and they'll be there after we leave you at 9 o'clock this morning. So, in fact, they'll be there all day. You think they're going to the beach? No, they're working. All right, 856-489-0505 is the number, 856-489-0505. That is the number for Innovative Medical Associates, Marlton, New Jersey. And you can also get more information on the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And remember, we talked about this earlier. The initial consultation is complimentary, and all you have to do is call and make the appointment with Dr. Molly, and that's where you really get a lot of your issues and your questions answered in the initial consultation. Again, the number to set it up, 856-489-0505. And don't forget, Health Watch replay every Sunday, 4 till 5, here on Talk Radio 1210 WPHT. We are going to go to the phones. It's Health Watch every Sunday, 8 till 9, right here, Talk Radio 1210 WPHT. Let's talk to Jeff in Broomall. Jeff, good morning. You're on with Dr. Molly.
Hi, Jeff.
Hi, how are you?
Good.
I heard you talking about chelation therapy, and I had tried that in lieu of getting a heart bypass.
Okay.
And I thought it helped, but I got a heart bypass anyway. That was about 6 years ago.
Okay. May I ask a couple questions, though? I'd like to know what did you do in addition to the chelation therapy? Anything? Like change your diet and, take some nutraceuticals?
Not really, just the chelation.
Jeff. It's not holy water. It's not holy water. Okay, go ahead.
Right.
Yeah.
But anyway, what I wanted to talk about, I'm sort of an amateur scientist.
Good for you.
And, I've worked for some of the pharmaceuticals in
good.
helping them set up equipment.
Sure.
And I discovered that there is a approved vaccine for the complications of COVID-19.
Okay.
It is called Prevnar 13 and Pneumovax 23.
Okay.
People get the number one complication that kills you
pneumonia, probably.
on COVID-19 is pneumonia.
Yes, I know. Yeah, are you?
Nobody's talking about this. That if you get these vaccines, you don't get pneumonia.
Well, here's the thing. I think that they are talking about it, at least in scientific circles, but they're also saying it is technically not quite a vaccine. Part of the problem is I can tell that you are a scientist. Part of the problem is you can't say that vaccine is a vaccine for Corona-19. You know that. You said it very nicely.
Stops the complications.
Right. You said it very carefully.
And the number one complication that kills
is pneumonia.
Is pneumonia.
Okay, and I agree with that.
And
but
if you don't get pneumonia, you don't need a ventilator. And if you get on a ventilator, that's number one cause of death.
You better believe it. But listen.
So if we did mass vaccinations of children over 8 with Prevnar 13 and everybody over 30.
Well, God bless you. God bless you, sir,
Jeff,
for giving people
thanks for the
this
information,
wonderful advice.
and we appreciate the call.
And
Thank
bless
you.
you. Thank you, Jeff. Look. You've never heard me say, don't vaccinate, don't do this. I'm never going to do that.
Right.
But I want people to understand. See, part of the issue, and I appreciate him, because
one scientist to another, right?
Right. I appreciate him, but he works in the lab. And, this is the big issue. This is what I have all the time. Speaking to my lab colleagues and then speaking clinically to patients. You start telling everybody, go out and get this. They think it's a vaccine for COVID-19. It is not. It's used for complications. And
after you get it, right?
You can take it. It's a pneumonia vaccine.
Okay.
It's just two vaccines joined together. Okay, fine. It's perfect. People get pneumonia. When you work in hospitals, you have to have a pneumonia vaccine. There's a lot of things, all right? Bottom line is this. That is not a vaccine specifically for Corona-19. And people need to realize it's for complications, which means it's for pneumonia.
Yes.
Okay?
Yes.
Let's not fool around. When you cut stuff to the chase and you talk to people, when people come into my clinic, they don't want to hear all this. They think if you have that in stock, it's helping them against the vaccine. And I'm going to tell you right now, the thing that's going to help you most against the vaccine is to follow good hygiene, to use your mask, do not socialize with 500 people you don't know, don't sit around a lot of crowds, follow everything the CDC is telling you. Obviously, God forbid, you should you have a pneumonia vaccine, you and your physician or one of my physicians, my wonderful Dr. Testa, will explain to you. Maybe you go to the primary care side of the house and speak to them about it. But, that's one way to handle it. The other way is to follow the CDC guidelines. That's all I'm saying.
All right, 855-839-1210. That's our number here for Health Watch. Sundays 8 till 9 here on Talk Radio 1210 WPHT. Let's talk about, you have a patient, and we often talk about pain and some of your protocols for pain.
Oh, sure.
And this particular patient is really in a lot of pain.
Yeah, RSD.
And so can you explain?
Yeah, well, actually, it's very interesting because I've gotten several more unknown pain syndromes that have just started with us. And one of the things that I'm finding is that people, when they're in this kind of pain, they try everything. But I think what really has to be said is we need to look at some specific types of anti-inflammatories. We know that there is something called a universal inflammation interleukin, and that's interleukin 10. So you want to work start by using something that works on interleukin 10, like curcumin and turmeric and those kinds of things. But I use a lot of anti-inflammatories on these people because, again, I'm back to some of the things that really cause a problem. Most of the times, people who come in with this, it's for systemic inflammation. And if they follow certain protocols that we have in place and utilize certain oral or tinctures, in addition to some subclinical doses of medication, we tend to be able to get the pain syndromes under control.
All right. So is this similar to a lot of other conditions where hydration is involved? But
in our protocols, yes.
Is it more hydration?
It's not about the hydration. It's about what we utilize in the hydration.
Okay.
The amount of the anti-inflammatories, the amount of the homeopathics, the amount of the subclinical doses of the traditional meds at off-label use. So again, it's combination. And what we try to do is we try to sit down when I'm in conference with the docs and everything and the healthcare providers, we sit down and we say, okay, what's going to work for this particular patient? And I will say this, there are some universal nutraceuticals that work for pain. CBD is one of them. I mean, there's a lot of data today to say this. But again, it's about the dosing requirements. And the dosing requirements vary from the amount of pain, if you use the pain scale, which goes from 1 to 10, traditional pain scale. And it also varies on the metabolics of a particular patient. So there's always an ebb and tide. There's an art to this, John. It's not just throw the bag together and it's going to do the thing. It's not holy water.
Right. Inflammation, you have often said, is a pretty serious problem.
Inflammation is what I call a two-edged sword. We need inflammation for many things. If you cut yourself, you're in trauma. You want to have inflammation to stop that bleeding.
Right.
Right? That's what it does. It sends the blood cells down there and boom. However, if it's such a situation where it doesn't turn off for whatever reason, right? If it doesn't turn off for whatever reason, you start to have your nerves in an overstimulated type of situation. Therefore, you need something to help with that. So again, I call inflammation our biggest enemy, but it can also be our biggest savior.
And you control that with not just the hydration, but with other things.
Other things, with tinctures, but with specific nutraceuticals and natural products in a particular protocol.
Why is it that you have had in the last, let's say, several months, a lot of pain patients?
I think it has to do with the autoimmune syndromes that are going around, including Lyme, post-Lyme. I've got a new test in that I'm actually going to do on one of my youngest patients who comes up from Ocean City. She's a great kid. She's doing very well. You know, if anybody saw her, she was sitting in a wheelchair, but she was sitting in a reclining wheelchair that looked like a stretcher.
I remember seeing that.
She's doing much better. She rides her it's a particular type of bike that she's riding around Ocean City, so she's in less pain than when she came in. And I really believe what she has is the post-Lyme syndrome. Yes, they tested for Lyme. She tested negative. Now, I want to do a particular test that's going to test for all of the bacterial or viruses that is left by the tick bite, because I think that's the problem.
Okay, we have more to talk about here on the show, but boy, time flies when you're having fun here as we're coming up on our final break of the morning. Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates in Marlton, New Jersey. And I'm your host, John DeMasi. Got some time for a couple more calls. If you want to jump in here, 855-839-1210. 855-839-1210. We are returning with more of today's Health Watch after these words. Welcome back to Health Watch. Operators are standing by right now at Innovative Medical Associates, and they'll be there after we leave you at 9 o'clock this morning. And you want to call right now, you can. You want to call after 9, you can do that too. 856-489-0505. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. When you call, you can get more information. And most importantly, you can make that initial appointment, initial consultation with Dr. Molly is complimentary. All you got to do is call and set it up. 856-489-0505. 856-489-0505. More information on the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, today's show replayed every Sunday. If you can't make it listening to us this morning, maybe you're in church or whatever happens to be, the show replays every Sunday 4 until 5 here on Talk Radio 1210 WPHT. Again, our show is Health Watch every Sunday, 8 till 9, the live version here on Talk Radio 1210 WPHT. 855-839-1210 is our number if you have a question for Dr. Molly. We do have a couple minutes left of the show, so you can jump in here pretty quickly. I know you wanted to talk about this, and you mentioned autoimmune.
Oh, right.
And you have a patient with kind of a mixed bag in terms of autoimmune.
Right.
She doesn't
really have a definitive diagnosis of a problem. She's young, very, very bright, has done a lot of research on chronic autoimmune, and she clearly fits the profile of chronic autoimmune. Now, she had one drip so far, and I'm sure, as I like to put it, one treatment is not a cure. It's not a cure anyway. What we can do is help her get some of her symptomatology under control. Now, before I put people on some other things like the tinctures, etc., I like them to go home, read about them, really study it, and then come back to me with their questions. But I don't do that. I want them not to be in fear, because the problem is, personality-wise, you can put yourself in a situation where you always see the glass as half full. And I want us to start looking at this differently. Yes, this is not holy water, but it is a functional medicine protocol, meaning we're all about improving your quality of life, and we can get there. So just because some medication that we may tell you to take, by the way, we're talking about a medication that you use normally up to 300 milligrams. I'm looking at it, using it at 0.5 milligrams to 4.5. You see the difference in this? So don't you think that the side effects of that would be much less? Sure. If you even had any?
Sure.
Probably won't even have any. And in all the time that I'm using this, and by the way, I'm on a particular website about this. It's called I won't go into that here on the radio, but if you call me, I'll tell you what website I am affiliated with that talks all about this medication. And although the medication was used for a detox or an opioid or a opioid reversal, this medication has the propensity to help us with autoimmune disorders, and in a big way. For example, one of my doctors is on it right now for her MS. Another one of my doctors is on it for autoimmune and kidney-related problems. I have patients on it with neurodegenerative diseases, along with utilization of the hydration. And by the way, John, you know that my doctors take IV hydration.
Yes.
You know that. Once a week at least.
You do yourself.
Of course. So the bottom line is, we don't use a protocol that we don't believe in.
I wanted to ask you, you mentioned briefly, and I think this is important for people to know, that you're part of several organizations who you consult with.
If we need to,
if
sure.
you need to.
And I'm not afraid to do that. In other words, I don't have the only book that was ever written on nutritional medicine. I don't have it. There's a litany of things out there, and I try to read as much as possible and update protocols as much as possible so that, we're not afraid to try new things, but we also have good old standbys, the tried and true that has worked for 23 years.
Like vitamin C.
Like vitamin C, like chelation if used properly.
Yes.
I'm sorry that this gentleman had to have a bypass, but I'm not against it.
Right.
I mean, obviously, if you didn't change your lifestyle, then somebody who was giving him the chelation didn't do their job in educating somebody that you need cardiac nutrition too.
Right. It's not.
And that's one thing you'll hear at our place.
Oh, I know.
We're not going to say, here, this is all you need to do. Keep coming back. It's not about that. It's about a full program.
I also wanted to mention that you're part of an organization of integrative medicine, right?
Yes, both with conventional MDs, DOs, chiropractic, which, by the way, I believe chiropractors are at the forefront of innovative medicine. They've been around long.
How is
because they know a lot about nutrition. They understand systems. They know what they're usually very good about the scope of their practice, what they should and shouldn't do. And I just think they're really very, very important, and they can help relieve pain in some areas.
You know, it's interesting. Years ago, and you remember, I was at another station and I was doing a show on health every week. And I asked one of the medical doctors, and I said, how much in medical school did you get on nutrition and natural? He said about a half hour.
That's right. That is about right. And it's still that way because they have so much material to cover. And every day, like this gentleman's telling you, there are new drugs put together or two old drugs put together to form a new drug. And these guys, our physicians, have to stay on top of that kind of thing. So
I wanted to also ask you, because we did get a call, and there appeared to be some level of skepticism, and I know that you get that
every day.
Every day. How do you get people to understand what you do and how it may be beneficial?
I think the only way to get people to understand how you do is what I say. You come to us in desperation. And that's the key. And then I need you to talk to all of my patients, because so many of them have had experiences in desperation medicine and find out that the cure is worse than the condition. Look, John, I'm all about your quality of life, and that includes our cancer supportive patients. Can we cure cancer? No. Can we help you have a quality of life that maybe, just maybe, there's a new breakthrough pharmaceutically or surgically or interventionally that can help a patient? I want them to be healthy enough to be able to take that.
Interesting, a couple of weeks ago, I'm sitting in the chair, and there's a patient, and her mother was sitting next to her, and just said to me, well, how long you been coming here? I said, 20 years. And she went, what?
Yeah.
I guess it works, huh? So
Yeah.
I guess it does.
It does work. It does work. And the idea is, remember, this is a quality of life. We are functional medicine people in that we look at this, we want to improve your quality of life, and that gives you a whole range of opportunity conventionally, meaning in terms of traditional medication and traditional medical advice, and also the alternative. So we don't discount anything.
And you've never really said, you're talking about some things that you have said you've proven can help. You're not telling people to throw away the medical
Never
doctor
will.
or any of that kind of stuff.
Never will. I come from conventionally trained. I ran a hospital laboratory. I'm not, I'm conventionally trained. So therefore, I'm not going to say this, but I am going to say you're responsible for your quality of life, and you should do your own research.
Any words of wisdom before we leave the folks this morning?
Well, I want people to have an open mind and feel free to call the office. Come in for the free consultation. I promise you we don't have a hook there to put you in a chair. Okay?
Okay. That is just about going to put the wraps on another edition of Health Watch. Don't forget, operator standing by right now, 856-489-0505 is the number. 856-489-0505. Also, go on the website. You get a lot of good information on that as well. It's innovativemedicalassociates.com. That's innovativemedicalassociates.com. That's the website. Don't forget, if you missed any of the show this morning or you want to hear it again, this afternoon, 4 until 5, Health Watch replay here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Dee, fabulous Franny, and our nurses Jess, Michelle, Crystal, and our medical assistant Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210 WPHT. You take care.